Today's topic is on human metapneumovirus. This is not a virus that's talked about as often as flu and COVID. They're like the main characters in the virus world, but human metapneumovirus does play a role and does get some people feeling sick. The outline of today's talk, it's mainly in two parts. The majority will be on human metapneumovirus. We'll be going through these questions of what is it? What symptoms does it cause? Prevention measures. And then the second half of the talk, a little bit shorter, will be just miscellaneous topics such as asthma and filters, and then also an update on the flu season. Human metapneumovirus was discovered in 2001 by scientists in the Netherlands. However, it's thought to have been around for over 60 years, and it just hadn't been, in a sense, sequenced or figured out until 2001. But human metapneumovirus has been found around the world, and it tends to show up in late winter in the places in the world that have seasons, such as us. So we're kind of entering that late winter phase, actually. So human metapneumovirus may be playing a slightly bigger role than earlier this winter. And places that are sort of the same temperature year round, they have a different rhythm with virus season. We're entering that phase where human metapneumovirus is one of those viruses that are circulating among us. The main people to get sick from human metapneumovirus are young children and older adults. And these two groups of people, for various reasons, more so the older adults have like lower immune system, and so it's a little more difficult for them to fight back a virus. And young children are more at risk just because they're new to the world and they're just getting exposed to all these different viruses and infections all the time. I would imagine parents of children or people who take care of young children, it feels like every month they're getting sick with something. Human metapneumovirus is in that rotation. Most children have gotten human metapneumovirus by the time they are 5 years old. Just about everyone has been exposed to it by the time they're that age. And it is unfortunately possible to get reinfected with the virus throughout one's life. So even if someone had it when they were 5 years old, they could very well get it as an adult or as an older adult. As I mentioned, older adults are at risk for having more symptoms from this virus because of the immune system, because of other chronic conditions they may already have. But anyone can really get this virus. It's just these two groups of people that may have more symptoms than the average adult. What are some of those symptoms, you may be thinking? So the symptoms for young children, things like cough, runny nose, a fever, wheezing, or when they're breathing, they make a noise. And for older adults, they can have symptoms such as cough, runny nose, or congestion, sometimes shortness of breath or trouble breathing. They could also have wheezing, and they can also have hoarseness of their voice. And so you might be seeing this list and just be thinking like, that could be like a lot of viruses or any cold, really. If someone's like, oh, I'm feeling under the weather, I feel like I have a cold, they'll probably list off these symptoms. So it could very well be that they could have a cold virus, they could have human metapneumovirus. There's a lot of overlap between what these viruses can cause in our upper respiratory tract and also a little bit of lower respiratory tract. So as a reminder, our respiratory tract, or basically the part of our body that's involved with breathing, starts with our nose and mouth and goes through a breathing tube in the center of our throat, and it splits off into two sides, as you can see here on the right, into two lungs. So basically the respiratory tract starts at the mouth and nose and goes all the way to the lungs. And it's divided into two parts. Basically, I think of it like the part above the throat is the upper respiratory tract, and the part below the throat into the body is the lower respiratory tract. Human metapneumovirus typically, as we saw those list of symptoms, mainly focuses on this part of the upper respiratory tract. Runny nose, hoarseness, coughing, things like that. But it does involve some of the lower respiratory tract, mainly the lungs and the different tubes in the lungs, if the symptoms get worse and if the infection gets worse. So for young children, if the virus causes or caused for the child inflammation of the airways of the lungs, or caused an asthma exacerbation, or even caused a pneumonia to happen for that child, that might be a reason to have this child go to the hospital, for example, and get further treatment and further support so they can get through this infection. Similarly, but different for older adults, if human metapneumovirus causes eventually a pneumonia, potentially like it started off as human metapneumovirus, but then a bacteria came in and caused the pneumonia to worsen, that could be a reason for the older adult to be hospitalized. And sometimes for older adults, it can trigger an asthma attack. But it seems like this virus in particular is less likely to cause a COPD exacerbation, just based on some studies that have been done. For the majority of people, human metapneumovirus is one of those viruses that causes a cold, basically. And we might not know if it's that virus or a different virus, but the way we're feeling is similar to just how a cold comes over us and passes through. So we may be feeling sick for about a week and then start to feel better. Maybe we have a lingering cough for longer than that, a week, 2 weeks. These colds can kind of stretch for different amounts of time. But I think it's exciting that we're focusing on human metapneumovirus, since I said it's not really a main player. But as you can see, it's not really a main player in the virus world because it doesn't cause us too much damage, fortunately, or cause too many people to go to the hospital. So that's hopefully reassuring. Even though it's a long, weird name, it usually causes mild infections overall. You may be thinking, well, what can we do if someone has human metapneumovirus? Can we test? We may test when someone has a severe infection, like if they're in the hospital. And this is just to try to figure out, okay, what might be causing this person's symptoms? Is it a bacteria? Is it a virus that we can treat for? Is it something else? So that might be the situation where we may test. But we don't typically test if someone's in a primary care clinic or an urgent care. We don't have like a point of care test like we have for COVID or flu. As far as I know, those don't exist for human metapneumovirus. I think it is possible to send out a swab to a lab. But again, if someone is coming in and it seems like it's fitting more the virus picture than a bacterial infection picture, it's unlikely for the clinician to test the patient for human metapneumovirus. Can we treat? This is kind of the main reason why we don't really test. Because it's a virus, antibiotics do not work against human metapneumovirus. Antibiotics are for an infection caused by bacteria. Human metapneumovirus, it's a virus. It's in the name, so antibiotics don't work. There haven't been large studies, but generally speaking, no studies have really been done to see if antiviral medications work, so medications that target viruses. As far as we know, we don't know if they would work if they were given to a human. There have been some studies where they're done in a petri dish, and maybe they could have some benefit, but we don't really have studies to show one way or another for humans. And so with that in mind, we don't have a medication to give someone, so we generally just support people as they get better on their own. We might give some recommendations on some things over the counter that could help with the congestion, or maybe a sinus rinse, or maybe some hot tea, or maybe some chicken noodle soup. The typical things that don't need a prescription can help people just get through their symptoms of like a week to 2 week duration. That's a main reason why we don't test. It's because we don't really have a treatment for it. You may be wondering, well, can we prevent human metapneumovirus? Because it's a virus, a lot of the same recommendations that we've been saying for flu, in many ways for COVID, still apply. So the recommendations are, it's important to wash your hands regularly. It's important to try to avoid touching the face, because if we like sneeze in our hands and then we touch our like eye, or someone else sneezes and touches a table, we touch that table and then we touch our nose, that's a way for the virus to get into our body. Wear a mask in public settings, especially if you're around a lot of different people. That's a way for virus to spread. Just droplets from speaking at one another, droplets from sneezing at one another and coughing at one another in the space. That's how the virus can spread. If someone is sick at home, try to have them stay in one part of the home if that's at all feasible. I know in many small New York apartments, that's not feasible. Also, if it's an older adult, maybe that's possible, but if it's a young child running around, not possible. It's also important to wash surfaces regularly to prevent spread of viruses. And at this point in time, we do not have a vaccine against human metapneumovirus. It seems like there are some earlier stage trials for vaccines for human metapneumovirus, but they haven't yet reached the stage for the public to receive them. And I would also imagine that because this virus tends to cause a more mild infection, either if there were a vaccine, it would be prioritized for younger children, like infants even, and or older adults, or there's unfortunately maybe not as big of a push to get a vaccine because the symptoms for a lot of people are mild. So it wouldn't be as beneficial beneficial to everyone on a larger scale. We will switch to part 2 of this talk, briefly talking about asthma and filters, and then also a flu update. I've been using the word filter, but more specifically, it's an air purifier. Technically, air purifiers are very helpful for people who are living with asthma, in part because it helps remove indoor air pollutants such as dust, pollen, smoke. It doesn't remove everything that can cause an asthma exacerbation, but some of those things are triggering factors for someone living with asthma to have an asthma exacerbation. So if we have an air purifier, we can take those out of the home, and then that person can have less exposure to these triggering components such as dust, pollen, and smoke. There's a lot of air purifiers out there with a range of cost, and I know some of those costs can be very expensive. The type of air purifier that one buys is connected to the size of the room that you're trying to purify. So if you're trying to purify a large room, you need a bigger air purifier. And similarly, if it's a smaller room, you can go smaller, and then those tend to be cheaper. It's good to avoid paying a lot of money for something that could be junk or not very helpful. So good to go with a reputable brand, and Consumer Reports can help with that. And just a couple slides on flu update, because flu is still relevant. So just to orient us to this Department of Health graph. So these are positive flu cases in New York State. So once again, the weeks are at the bottom. So it goes from October 5th all the way to May 17th. That's the stretch of flu season typically. And then the number of cases here on the left is in tens of thousands. So 10,000, 20,000, keeps going up to 60,000. These different lines are different years, different flu seasons. So it goes all the way from 2024, 2025, our current season, this red line on the graph, all the way back to 2021 to 2022 in the blue. So I know there's 4 different lines here, but we can focus on this red line. And this red line is just going up, up, up. So as you can see, it's actually higher than 2021 to 2022, which that season, a lot of people were masking, staying indoors. COVID was around. The pandemic was still ongoing. So flu wasn't really going around then. And the next year, it did pick up quite a bit in this green line here. But as you can see, this red line is still increasing and may go past what we saw in 2022 to 2023, which was a very early, very intense flu season. The message is we are in peak flu season right now, and it has not plateaued and gone down yet. So basically in New York State, since mid-January, there's like 40,000 people a week getting the flu, getting tested for the flu positive. So that actually means there are many more people than that who are getting the flu, but just deciding to like stick it out at home or not get tested. So these numbers are actually lower than what's in reality happening in New York State. So with that in mind, still not too late to get a flu shot. It would take a little bit of time to kick in as vaccines do, but it still would be prevention for the second half of the flu season, which we still have many months of. And this graph, it's the same idea, but instead of who tested positive for the flu, this is people who have been hospitalized for the flu or had to go to the hospital because their symptoms were so bad and so severe. This season with the red line, same idea, weeks at the bottom, number of people hospitalized on the left, and those go from 0 all the way up to 3,500. This red line has, it seems like, peaked for now and hopefully will be going down. But it is similar heights to the past couple of years for a number of people hospitalized at the peak of flu season. Hopefully seeing it over and over again can make it a little easier to understand what the Department of Health is trying to share. Although this is public information, of course, they're kind of sharing it in a technical way. And with that, just going to round out the talk with these couple of slides related to long COVID. People who have COVID, there's a risk for those symptoms to continue for longer than just a week or two. It can be several months, even years of symptoms, and that can be defined as long COVID. So people who are most at risk for long COVID are people who didn't receive a COVID vaccine or experience a severe COVID infection, especially those who are in the hospital, and including people who have other chronic medical health conditions. And there's a lot of different symptoms that are included in this long COVID diagnosis. There are over 200 different symptoms, include coughing or breathing problems, loss of smell, body aches, headaches, stomach pains, pain in different parts of the body, trouble sleeping, trouble thinking, fever, tiredness, changes in mood. And so if you have any concerns that you or someone you know may have long COVID, you can talk to your healthcare provider, and there's also a QR code to connect to long COVID clinics. Another plug for vaccines, the 2024-2025 flu season shot is still available. We are in peak flu season. COVID, there's still boosters available for this more dominant variant, and it's recommended a booster for anyone 6 months old and older. And if you haven't gotten the series yet, it's recommended 2 doses Moderna or 3 doses Pfizer. RSV is a shot against respiratory syncytial virus. It's one vaccine if you're over age 60, and they also give it to pregnant persons, and depending on when they deliver in the season. And last but not least, pneumonia, recommended if someone has different risk factors like age over 65, different medical conditions such as HIV, cancer, diabetes, heart disease, or if they're pregnant, pneumonia shot is recommended, even if they're in the adult age range of 19 to 64. However, if someone's over age 65, it's recommended no matter what for them to get the vaccine, regardless of their health conditions. In summary, human metapneumovirus mainly causes a cold. For some people, such as young children and older adults, it can be worse. Prevention occurs with the usual precautions of hand washing, mask wearing, cleaning surfaces, things like that. And for the second half of the talk, for asthma, air purifiers are helpful. They don't remove all of the potential triggers for asthma, but they remove quite a few of them. And for flu, cases are still going up, so it's still recommended to get that flu vaccine. Over the past couple years, the definition of long COVID has changed as we've gotten more information and seen more people getting long COVID. If I'm not mistaken, the cutoff point for long COVID is actually now 3 months. It used to be 1 month several years ago. So if that cough lingers past the 3-month mark, or any of those other symptoms that were listed, and like I said, there are even 200 symptoms that have been connected to long COVID thus far, that could be considered a possibility for long COVID. Unfortunately, for a lot of viruses, including COVID, including human metapneumovirus, including probably even just like the common cold, it can be common to have like a cough for like a couple weeks, unfortunately, because it's like you're feeling so close to get over this infection, and it's just like a lingering cough. But things to keep in mind is if that cough worsens, if someone is coughing to the point of throwing up, if someone is starting to get a fever, or like basically if they're on a trajectory of like, oh, I'm feeling better, I just have this cough, but now I'm feeling a lot worse for whatever reason, that's when it's important to get reevaluated by a clinician just to make sure that that lingering virus didn't turn into a pneumonia or something more serious that has to be addressed, if that makes sense. If it's just a lingering cough and it's sort of little by little, day by day, someone's feeling better, then it's more likely than not that person will eventually clear it completely, or the cough will resolve on its own. But those are some things to keep in mind that would warrant being seen by a clinician.
I think one of the things that we talk about with the vaccination is that it can make it so that your symptoms, even long COVID symptoms, are not as severe as they might have otherwise been. What would you say to somebody who says, I got all my vaccines and I got long COVID? What should I think about vaccines now?
Unfortunately, with anything in life, it's all about risk reduction. So I use the metaphor or like story of just like in life, we tend to stop at red lights and go on green lights. And that's just what we do, just like day in and day out, right? And there are some people who unfortunately run red lights, or they run yellow into reds, maybe every day or maybe multiple times a day. And it's more likely for that person to get into a car accident. However, there may be people who do that almost every day and they never get into a car accident in their whole life. And there are other people who every day of their life, they go on green lights and they stop at red lights and someone just T-bones them, causes a car accident from behind. Like that person did all the quote unquote right things to prevent something from happening, and yet it still happened. That's kind of how I think about vaccines to an extent too. Like getting a vaccine is kind of getting someone into that category of going on green and stopping on red. And so it lowers the risk, and hopefully the majority or a large majority of us will never get into a car accident by doing that. However, it can still happen, and that can be excruciatingly frustrating and maddening because it's like, I thought I was doing everything right, but not everything is in our control, and that includes getting infected and or potentially getting long COVID. It's sort of like a roulette wheel. Getting even a mild infection of COVID could mean that that person could get long COVID. It's less likely, but it still occurs, unfortunately. So I don't know if that story helps. I like to think of it because sometimes it's just like the universe, it shouldn't be working this way. It's not just trust, but sometimes it does happen in those scenarios. Like vaccines still work, vaccines lower the risk, but nothing is 100% in our control.